CPR for adult. Check scene. The rescuer who arrives at the side of the victim must quickly be sure that the scene is safe. State loudly, "The scene is safe." Introduce self and ask permission. I am a trained CPR or first aid provider. May I help? Check consciousness by tapping shoulder and shouting, "Are you all right?" Or, Hey, are you okay?" If you are alone and find an unresponsive victim not breathing, shout for help. If no one responds, activate the emergency response system by calling 9999, check a pulse and begin CPR. Locating the carotid artery pulse. To perform a pulse check in the adult, if you do not definitely feel a pulse within 10 seconds, start chest compressions. Follow these steps to locate the carotid artery pulse. Locate the trachea using 2 or 3 fingers. Slide these 2 or 3 fingers into the groove between the trachea and the muscles at the side of the neck, where you can feel the carotid pulse. Feel for a pulse for at least 5 but no more than 10 seconds. If you do not definitely feel a pulse, begin CPR starting with chest compressions. If no pulse, give 30 compressions. Follow these steps to perform chest compressions. Position yourself at the victim's side. Make sure the victim is lying face up on a firm, flat surface. If the victim is lying face down, carefully roll him face up. Put the heel of one hand on the center of the victim's chest on the lower half of the breastbone. Put the heel of your other hand on top of the first hand. Straighten your arms and position your shoulders directly over your hands. Push the chest hard and fast, at a rate of at least 100 compressions per minute. Allow the chest to recoil completely after each compression and minimize interruptions in compressions. Begin with chest compressions. Perform 5 cycles of 30 chest compression and 2 breaths. Open airway and give 2 rescue breaths in 2 seconds. Using an ambu bag, hold the mask properly. Thumb and index finger, C-shape, press the mask onto the face. Middle, ring, and little fingers, E-shape, lift the jaw forward. Ensure the mask covers the nose and mouth completely without air leaks. Squeeze the bag. Each breath should take 1 second and cause visible chest rise. Repeat cycles of 30 compressions and 2 breaths for at least 2 minutes, 100 compressions/min 4 cycles. Recheck carotid pulse. If pulse is absent, repeat CPR. If pulse is present, position patient to recovery or side-lying position and monitor patient. When to stop CPR. You noticed an obvious sign of life. Another trained responder or EMS personnel take over. You are too exhausted to continue. Scene becomes unsafe. ED is available and ready for use.